Good afternoon once again, and welcome. My name is Ivo Dinov. I'm a professor of health behavior and biological sciences and computational medicine and bioinformatics at the University of Michigan, and I lead the Precision Health Education and Training Working Group. We are very glad you've joined us today for the research update, specifically for the University of Michigan Precision Health Study participants. We warmly welcome each of you to this virtual event, which will offer a unique opportunity for researchers and study participants to get together and discuss both opportunities and challenges that exist in the space of precision health. Whether you joined a number of years ago or in the last month, you decided to generously contribute information to a huge collection of data, which pulled together is much more powerful than the sum of its individual components. The researchers at the University of Michigan use these data daily to search for patterns, model and forecast trajectories, classify cohorts, and predict various pathologies that exist in multiple disorders. The purpose of this event is to share a very small bit of that research that's ongoing. And thank you for joining us today and actively participating in medical research in general. As you will see today, your participation is making a big difference, not only in scholarly activities that we conduct, but also in terms of patient care. We would like to share some of the outcomes from our recent studies that use patient data and give you an opportunity to ask researchers and faculty, part of the Precision Health, various questions that you might be interested in having answers to. We hope this will be an interesting and inspiring event for you as well as for us. We have a full and exciting event planned for the next 3 hours. The agenda today includes presentations about 4 research projects that are making a significant difference in healthcare. Each of these projects relies on data from participants like you. And you have a chance, again, during the individual presentations, as well as at the end during the panel discussion, to ask questions using the Q&A at the bottom of your screen. Now, if during any time of the webinar you need any help or support, please submit comments in the chat at the bottom of your screen. We have staff members who monitor the chat and who would respond. Because this event is set up as a webinar, only the presenting speakers' microphones and cameras will be turned on, and all comments from attendees can be typed in the chat and Q&A windows. When at the end of presentations and during, again, the panel discussion at the end, a question arises, please use the Q&A to post your question. I will be moderating these questions and I'll be translating these questions to presenters. We have planned a short break at around 2 o'clock just to help us transition, as you can see on the current agenda screen. And we hope to be finished by 3:30 in the afternoon Eastern time today. Once again, here is the agenda. And now it's my great pleasure to introduce my colleague, the Managing Director of the University of Michigan Precision Health, Rachel Dawson. Rachel is a lawyer by training. She came to the University of Michigan about 5 years ago with a strong interest and passion to create an organization that would help researchers from multiple academic disciplines jointly advance precision health research. So in the next 20 to 25 minutes, Rachel will share with us what exactly precision health is and provide some background about how and why participants like you that participate in this initiative make it possible. Rachel?
Good afternoon. Thank you, Ivo, for that introduction. I want to join Ivo in welcoming all of our participants to today's event and to thank you for the significant contributions you have made to make precision health possible. As mentioned, I'm Rachel Dawson and I'm the Managing Director of Precision Health. My daily job is to oversee the operations and administration of this very important healthcare work, but I'm not a medical doctor, nor am I an engineer or a scientist. I am a lawyer, And so people often ask, so what brought you to this work? My experience as a manager and an administrator brought me to this work professionally, but I came to this work personally for very personal reasons. I am a person with a chronic disease and a rare disease. For many years, managing my chronic disease was complicated, and no one understood why until I came to the University of Michigan's healthcare system and they discovered my rare disease, which informed them on how to better treat me overall and to improve my healthcare outcomes. So precision health matters to me on a daily basis as it helps me stay healthy and able to engage this very important work. And so, like many of you, I am here because I wanted to do my part to improve health outcomes, not only for myself, but for my community and for people throughout our nation. And so let me get to my job of telling you a bit more about what is precision health and to update you on some of the very tremendous work that we are doing. So what is precision health? When we state it formally to our colleagues, to the faculty, to those who help us do this work, we say that we're an innovative campus-wide initiative connecting rich health-related data and state-of-the-art analytic tools with our research community, creating a catalyst for interdisciplinary health discoveries to improve health outcomes. But what does that really mean? First, I want to emphasize the campus-wide aspects of this. At the University of Michigan, it's not just our medical doctors, but it's also our engineers, our biologists, our social workers, our social scientists, even our entertainers and music students who have come together to figure out how can we better improve healthcare outcomes through an interdisciplinary approach, because we know that many things impact health far beyond just your genetics, your family history, or the things that you do each day. And so in the past, when doctors have worked with patients, they looked at things like your family history. Did your mother's side of the family have cancer? Did your father's side of the family have heart conditions? They look at the blood work that they draw to see if there's things that can tell us. But in a precision health approach, we look at much more. For instance, we've learned that your zip code might impact your health just as much as your genetics. How does the environment impact your health? How does your lifestyle choices such as diet or exercise or sleep or other things impact how you feel from day to day, or how diseases might impact you should you contract one? So we use all that data and it informs us on how to better not only prevent disease, but treat disease once you have contracted one. So said another way, we learn more about you so that we can better treat you. Precision health is also you. You are so important to this work, and none of this could happen without your contributions. And as Ivo stated, many of you have come to us in different ways. Most of you have come through us through something known as the Michigan Genomics Initiative, also called MGI. MGI actually celebrated its 10th anniversary this year, and about 68,000 of you have come to participate in precision health through MGI. Other participant cohorts that you may have come to us from include Michigan and you partnering to advance research together, also known as MyPart. MyPart complements the work of MGI, but helps us to diversify those participants because we want to be able to better treat all people from all cultures, races, and ethnicities. Some of you came to us through other studies, such as MyPact, where we partnered with Apple to learn more about healthcare, or through MEND, which focuses on metabolic disorders, or through Prompt, who's doing innovative work on how to work with those who are seeking care for mental health disorders. And so, as much as precision health is about our faculty and researchers, it's about all of you who have joined us and contributed. So who are the people in your community? We keep talking about a participant community. What makes up that community? So in total, between our studies, MGI and MyPart and our other partnering studies, currently we have around 92,784 participants in total. So we are reaching a very important landmark of almost 100,000 participants. Within that participant group, about 51,000 are women, about 41,000 are men, 3% are Hispanic, 6.5% are Black or African American, about 3% are Asian, and 2% make up other minorities. and underrepresented groups in our society. So we get all your data, but what do we do with that data? As I mentioned, we collect data from you in various ways. We get your blood samples or your saliva samples, and we run genetic analysis on that data. We collect a wealth of data from you via surveys. I'm sure many of you recall filling out surveys for us, be it the EpiQ survey or some of the pain management surveys distributed through our anesthesiology department. So with all that, we learn about where you live and what things may be going on in your community. Is there a healthy water problem? Is there access to healthcare problem? Are there certain types of industry in your area that may impact your environment? And so we take all that data to help us discover how diseases develop and progress over time. And looking at that data, we then try and figure ways to try and prevent disease, or we create novel treatments once you have a disease. And the important thing is, unlike many studies in the past where we make great discoveries and we publish about those discoveries, Precision Health is so committed to making sure that we take those discoveries and incorporate it in your care as you're being seen by your physician or on the bedside where you might be inpatient with us in our hospital. And so we do the whole pipeline from discovery to actual patient care. And just a few examples of ways your data is being used. It's being used in studies around cardiovascular disease, a range and different types of cancers, depression and other mental health disorders, healthcare access studies, substance abuse studies. You'll learn about some of the work we're doing around opioids when you hear from Dr. Brummett a bit later, as well as diabetes and other metabolic disorders. So your data is contributing to so many different types of diseases and helping us learn so much more about how they progress. And we're making real discoveries. Some of those discoveries, for example, include our ability to identify genes that might lead to cancer, and they're developing ways to tell the body, don't translate the message from that gene, block that message so that we can block the cancer. And many of you are familiar around how that type of technology might work, as we've all seen the vaccines created for the COVID-19 pandemic, where that vaccine specifically said to our bodies, when you see this type of spike cell in the body, create antibodies to fight it, to help us fight against COVID, the spread of COVID, or the more dangerous aspects of long COVID or rough COVID. And so the discoveries are happening on a daily basis because of your contributions to this very important work. I talk about how we're using your data, so I want to give you some very real examples of how it's working in our state, in our nation, and around the world. Here at Precision Health, as I stated, you're going to hear from Dr. Chad Brummett a bit later to talk about some of the work he's been doing around opioid misuse. Throughout that work, Dr. Brummett and his team have been looking at a number of patients and studies to see if they can identify, for instance, the risk factors that might make ones more susceptible to opioid misuse. They've taken that information to develop new prescribing conventions, and so that doctors are doing a better job at prescribing opioids to prevent it from leading to misuse. For instance, you'll see most of you may have recently gone to the dentist and noticed that in the past where they may have prescribed you an opioid to manage that pain, now they're back to prescribing ibuprofen or Tylenol or just as effective medications that have far less ability to make one addicted to those drugs. And so that work is going on and it is being used around our state. Even more interesting, the work of Dr. Brummett and his team has led to the creation of a musical developed by one of our students at our School of Music, Theater, and Dance. The musical is called Painless, and that musical will be incorporated in curriculum throughout the state of Michigan for high school and middle school students to help them understand the dangers of opioids, to help them learn how to avoid those dangers. I'm one of the few people who've had the privilege to actually see that musical live, and it is powerful and it is meaningful and it really touches you and it really makes you think. And one of the things I think very interesting about the musical is not only that it warns about the dangers of misuse of opioids, but it helps students to recognize the situations are triggering events that might cause them to consider the use, and helping them to identify those circumstances is equally important. And so this is just creative work that's happening at the University of Michigan, one of the few schools where the medical school and the music school could partner to have such a meaningful impact in our state for our students to help battle the opioid crisis that has ravaged our nation state by state. Another interesting piece of work that has happened as a result of your contributions to precision health in our participant cohorts is the discovery that pulse oximeters have a bias for people with darker skin. I'm sure many of you, when you've gone to the doctor or to the hospital, are familiar with the little instrument that's in the photo there at the bottom of the page, where they put it on your finger to measure your oxygen intake and to measure your heart rate. And that gives us a wealth of information. Oftentimes it may indicate whether there's some type of disease or infection or pain that you're experiencing that's impacting your heart rate or your oxygen intake. And unfortunately, it was discovered by some researchers here at the University of Michigan using your data that those instruments were not as effective on patients with darker skin. And as a result of that study, the University of Michigan actually received a letter signed by Senators Elizabeth Warren, Bernie Sanders, and Cory Booker, instructing the the Food and Drug Administration to actually do research, to do an investigation on that instrument and similar instruments to ensure that they are working properly for all patients across our nation. And so we're having a national impact on healthcare for people around the country because of your data. And finally, I wanted to share some of our international impact and work. You all participate in MGI and my part, and we've been able to take your data and combine it with data from other biobanks around the world, such as the UK Biobank or the Israeli Biobank, and nations around the world. And the more we see, the more we learn. The more we are able to look at thousands of people and find patterns or similarities or find unique attributes of certain communities, helps us understand people better, understand disease better, and therefore treat disease better. And so your data is being combined with data around the world so that we are having international impact because of a choice you made sitting individually when you came to one of our clinics to receive treatment, or responding to an email that we sent to you at home. And we just want you to appreciate how meaningful the work is, how important your contribution is, and the impact that you're having every day on health outcomes. And so again, I want to say thank you. We appreciate you. We hope that you will enjoy the rest of our programming as you hear from the fantastic scientists who are doing this work each and every day. And so from the bottom of our hearts, I say to you, thank you for doing your part to improve outcomes around our nation. And I return you over to Ivo.
Thank you very much, Rachel. We have two questions posted by Sarah on the Q&A. I wonder if you or one of our colleagues would be able to address it. The first question is a very interesting one. She says, I'm curious about how the demographics specifically of the PH participant group compare to the demographics of other research studies, presumably at the University of Michigan and nationally. And second of all, are they about the same, or are there any interesting divergences that we have in the cohort part of the precision health?
Excuse me, I'm happy to answer that, Ivo. The precision health participant cohort right now is about 92% of European descent. And so we aren't as diverse as we would like to be. And mostly that's because most of the participants come to us as patients at the University of Michigan because of our location and who we tend to serve. It's a largely European community. And so, as I mentioned, one of the things that we have been very committed to is diversifying that cohort, which is one of the reasons why we started the cohort known as My Part, because we are directly reaching out beyond Michigan medicine to reach the patients and participants in other settings to help diversify our cohort. And it is one of our top priorities this year and moving forward. And so we are heavily European and looking to improve that. For instance, we've partnered with the University of Texas Medical Branch down in Texas that has a large Latinx population to improve our Latino participants. We're working with the Access Group in Dearborn, Michigan to increase our MENA populations, and also looking at opportunities to improve African-American participation in Ypsilanti, Flint, and Detroit, and other surrounding areas. So it is something that we are working on, that we are keenly concerned about, and hope to see improved numbers as we move forward.
Thank you, Rachel. There is also a second question from Sarah that asks, I'm curious about how recruitment was done and is proceeding at Precision Health, since she couldn't recall the initial moment of how she got personally engaged. So what is the outreach, Rachel, that we make?
That's a great question. Thanks so much, Sarah. A lot of people may forget how they got to be part of the cohort, especially MGI, which started 10 years ago now. And so our main recruiting mechanism, especially previous to COVID, was you were typically approached while you were in the waiting room to receive some type of procedure at one of our clinics. And so someone might approach you while you were waiting for your turn for your procedure and ask you if you were interested in the study, and they walked you through what participation meant, and you probably signed on right there. If you didn't sign on with us in one of our perioperative procedure areas, typically you received an email from us and you responded to that email. And so once you respond to that email, you probably received a call from us in which we talked you through the process over the phone. And the next time you came in to the doctor and had blood work scheduled, we got your blood work, or we physically mailed you a saliva kit to collect your sample. And so in our clinical spaces, via email, or sometimes at community events, have been our typical way of recruiting our participants.
Thank you for the question, Sarah, and a very informative answer, Rachel. The third question that just arrived from Mary asks another quite intriguing thought. What happens to participants that drop out of a study because, for example, they opt out of certain treatment or other procedures? Would their data continue to be used prior to their disengagement from the study? So in other words, for example, their demographics, it's already recorded. Would it be used for other purposes?
Thank you. That's a great question as well. So once you agree to participate in our participant community, we have the data and we use the data. Your data is protected. Your identity is protected. For instance, researchers across the university that use your data don't know it's you. So for instance, Dr. Valley and Dr. Bonnard and Dr. Brummett may be using your data, but they have no way of knowing, for instance, it's Sarah or Vicky or Rachel or Tina or Ivo. So if you are a participant and you decide to no longer participate, you do have the right to explicitly ask that we no longer use your data moving forward, but it will have been used in previous studies likely, and will be part of that study information.
Thank you, Rachel, for that informative answer. Any other questions or comments anybody wants to ask before we transition into the more specific part of the presentations? The overall organizations of Precision Health, the type of studies, the cohorts. These were indeed very interesting questions. And I wanted to chime in here just in the interim, because we do have a minute or two. The question about the demographics of the cohort is a very interesting one. And when typically researchers approach Precision Health for a subset of the data, they would typically come up with inclusion and exclusion criteria that they want to have. And if they're looking for a specific breakdown of demographics, they can enforce these during the pull out of information from the 100,000 participant list and cases that we have, so that a specific subset that's retrieved from the precision health can actually have a demographic breakdown that is distinct from the overall, right? Rachel, am I correct in that?
Absolutely correct. And so
Okay.
most of our researchers, when they want to do a study, they will use some of our tools and they come with a very specific question. So for instance, they might say, I'm doing research on African Americans with diabetes. And so who in your cohort qualifies for that? And so it's a very rare situation when a given researcher is looking at all 92,000 participants. Typically, they're looking at maybe 500 participants or 2,000 participants. And so they have very specific questions they're trying to answer and get to.
Okay. Thank you once again, Rachel, for this informative precision health overview, for the responses to the thoughtful questions that came from the audience, and for the background information, which provides a nice leveling playing field for us to transition into hearing about more specific research studies kind of going forward. So I want to remind the participants that during the question and answers of upcoming presentations, you can enter your questions in the Q&A that's right at the bottom of your screen, and we will typically introduce these questions at the end of each presentations, as well as during the panel discussion session that will take place at the very end.